everybody. It's Dr. Kelly OMD, and we are back for another amazing episode of Ask Dr. Kelly OMD. I am so excited that you are here tonight. I'm excited because we have one of my favorite nurse practitioners. She is from America's finest city. Does anybody know where that is? I'm sure you do, because that's where I hail from as well. But she is from America's favorite city. We are so grateful to have Danielle Gordon, nurse practitioner extraordinaire, on tonight. She's just going to start us out by telling us a little bit about herself, and then she's going to tell us what are the top 3 things she wants us to take away before she gets into her presentation. So, nurse practitioner Danielle, go ahead and take it away.
Yes. So, hi, everybody. I am nurse practitioner Danielle. My patients call me NP Danielle, and I'm a board certified family nurse practitioner. I've been a nurse practitioner almost 10 years, going on 10 years now. Wow, that's crazy to say. Time is flying. And I also co-found and co-own IWC Primary Care, which is a family medicine primary care clinic here in the best city in the world, San Diego, California. And I'm excited to share with everyone the great things to know in terms of primary care and how we can be an advocate for you. And so today we're going to be talking about who those primary care providers are, what they look like, and what's their plan for our health. The preventative screenings that happen with the primary care provider, what can be done in the office, and what are maybe some things that we send out. And then what that treatment plan looks like and how the primary care provider can really advocate to see that treatment plan go through depending on what each diagnosis is for a patient. So I'm excited to dive into this.
Well, yes, absolutely. And I just want to let our new guests know how things kind of go here. Nurse practitioner Danielle is going to present to us for about 7 to 10 minutes, and then we're going to go into Q&A. If you are a member of the Viva Life Health Hub or Viva Life SPFME program, you get to ask your questions first, so we make sure those get answered, and then we invite our guests to do the same. So be ready, because there's going to be great opportunity for you to interact with nurse practitioner Danielle, and we're very excited that you are all here. So MPD, go ahead and take it away.
All right. Well, thank you, Dr. Kelly O, for having me on. It is an honor to join you on this webinar. So let's dive on into how our primary care provider is our advocate. So first, let's talk about who a primary care provider is. And this can look like many different people. We have physicians who can either be MDs or DOs. We have physician assistants or PAs. And then there's also, like myself, a nurse practitioner or an NP. And each one of those individuals are trained for different lifespans. So for example, in internal medicine, they'll train to take care of individuals aged 18 and up. Pediatricians are trained to take care of individuals from birth to age 21. And then there's family, like myself, where we're trained across the lifespan, so from birth on up. And family is really unique because we really get to engage not only with our patient, but usually their family members are also our patients. So we get to know the whole family, and everyone comes in and they're sharing stories, and they're talking about lunch, and they're bringing us lunch because now we know mom, we know grandma, and the grandchildren. So it's really a beautiful thing. So our primary care provider, or PCP, or if you're in the military, it's called a primary care manager or PCM. They're really like a coach. If you want to think of it like a sport, they're your coach that's here to help call out plays, and their goal is their treatment. That goal is to keep their patient on a path of a healthy lifestyle or help them to return to that healthy lifestyle plan. And that can look like a variety of things, whether it's diet and lifestyle counseling, whether it's referrals to different specialists. So we interface and interact with a lot of different groups to help our patients reach that goal. One of the main things that your PCP is responsible for are going to be those good old preventative screenings. As we know, it's February, so it's Heart Health Month. Heart disease is the leading cause of death, but it is also preventable. Simply knowing our blood pressure, our blood sugar, our cholesterol numbers are a huge factor in how we reduce our risk for heart disease. And that is something that we do in primary care all the time. I generally have patients coming in doing lab work every 3 to 6 months, depending on what we find. And we're talking about diet and lifestyle measures or medications to help bring those numbers into an optimal range. In addition to that, your primary care provider is going to do everything from your cancer screenings to your vaccines based off of age and family history. So some of those things may include cervical cancer screening. Yes, in primary care, your pap smear can be done with your PCP. Prostate cancer screenings. I know most of my men, when I say prostate, they're like, what you about to do? And I assure them, we don't have to do a rectal exam. This can all be done on blood work. We can order a PSA, and then we can make a determination if we need to send you to a urologist. In addition to that, there are breast cancer screenings, colon cancer screenings, lung cancer screenings for prior smokers. For our older women, we look at osteoporosis screenings to make sure our fracture risk is reduced. And believe it or not, skin checks. Skin cancer is one of the most common cancers among men and women. So just coming in because we have a mole that we're not sure about, your primary care provider can really educate each patient to let them know when to be concerned about a little spot or a mole that may have popped up or looks a little funny. And for our children, we are responsible for the developmental screenings to make sure our children are developing appropriately based on their age. And a big one that I love and is super important to physical health, but those mental health screenings, making sure that our patients don't have depression and anxiety, and making sure if we need to send to a therapist, that we do that. So our primary care provider is not only going to do those screenings, but their goal is to listen to the concerns of their patients, come up with a play or a treatment plan based off of our assessment and what's being told to us. We're like investigators in a sense. So we get the information that our patient tells us, we do an assessment, and we try to come up with a diagnosis. And sometimes, we may not have enough information on that day, but we're gathering information and we're putting a play together to figure out how to come up with a final solution. And sometimes that final treatment plan may look like medications, where we're educating our patients on the options and side effects. It could be a referral to a specialist. And this is where insurance can make it a little bit complicated, because if we have an HMO, for example, we need an authorization to go see a specialist. Whereas if we have a PPO, we can just, in a sense, walk on in. But I don't know about where you all live, but in San Diego, a lot of times the specialists won't see you unless they have some sort of notes to understand why you're coming. So it really is important to have a good PCP who can advocate on your behalf to send those notes and send why we're sending a patient there, so that we can get that treatment plan that we're looking for, excuse me. And then finally, in primary care, we order a lot of diagnostic tests. So let's say you're coming in complaining about, oh, I have a lot of fatigue, or I'm not really sure what's going on. It could be a multitude of things, but we usually start with lab work because it could be anemia, it could be your thyroid, it could be an autoimmune condition. But in order to get an answer and put a treatment plan together, we're going to start with baseline lab work to assess what the issues are. And then a big part of what we do in primary care is a lot of education and counseling, because believe it or not, I hear my patients tell me all the time, they go in, they get lab work, and then they have no idea what anything meant, and they left and they were more confused than when they walked in. And that's really a disservice. And I would say, please get a new PCP, because these are your labs. This is your body, and you have a right to understand what every line item means. And so at IWC Primary Care, we explain to our patients what we see, why we're medicating for certain conditions, and what our goal is to have optimal health. And some of that education is as simple as reminding our patients to brush your teeth and go to the dentist. Because again, being Heart Health Month, dental care is important in terms of cardiovascular care. So sometimes those little reminders are going to be a big aspect of what we do in primary care, and keep seeing our patients healthy moving forward.
Wow, this is just amazing. And this is why I absolutely, first time I met you, I fell in love with you, because you're just such a relatable provider, and you take such great care of your patients from a family standpoint and a family point of view. So, Viva Lifers and guests, go ahead and start getting your questions ready, because I know you have them. I know that, and I'm going to start off. So, I know that as a nurse practitioner, there are some people that are concerned. Is there a doctor around you, or how do you work together with the physicians so that you're providing optimal care to patients?
Oh, that's a great question. We actually hear that a lot. So in California, it's a little bit unique where our nurse practitioners, we don't have full practice yet. That's something that's on the law books. So every nurse practitioner is in a collaborative relationship with a physician. I just am so blessed and lucky that my collaborating physician, who also co-owns the clinic with me, is a mentor and like the GOAT of everything. So if you do not know Dr. Susanna Flalo, please get to know her because she is amazing. She holds a monthly health fair every first Wednesday of the month at the Jockey Robinson YMCA here in San Diego, where she's giving free community resources to the community, whether that's free blood pressure screenings, free cholesterol screenings, free diabetic checks, free food, healthy food, because we all know nutrition is a part of health. So we are like this. We're like two peas in a pod. So I'm blessed. A lot of times when patients come in, they're wondering, well, who's this Dr. Susanna Flalo on my card? I want to meet her, right? It happens, and it's okay. I walk in the room and I meet them and I greet them with kindness and respect. A lot of times patients don't realize what a nurse practitioner can do. So most of the time when we have that, they think that we can't prescribe medications or put in referrals. So that's really at the root of what the issue is. But I also tell them, hey, you're more than welcome to see Dr. Aflalo. So let me go ahead and schedule you with her on your next visit. And that usually calms everyone down. But once they realize that, they're more than capable of getting what they came for, then everyone's leaving with a big smile on their face.
I love it. I love it. I love it. I got a comment that says, I want you to be my primary care manager, nurse practitioner, Danielle.
Oh, come on.
Everybody in San Diego, then you need to go ahead and forward her information on. So that being said, do you do telehealth as well, or how have you incorporated that into your practice?
Yes, we do a ton of telehealth. So I am licensed in the state of California. So if we are in the state of California, technically I can see you. We do telehealth and in-person visits.
Okay, wonderful. And then go ahead, Viva Lifers, go ahead, and guests, go ahead and start ramping up your questions. And thank you, Sahara, for putting in IWC primary care in the meeting group. That being said, so we're talking about prevention. And as you know, I'm an OBGYN, so heart health is very important in the prenatal, perinatal aspect of health. And of course, Black women have higher risk of heart disease and complications than most people do. So that being said, I know that so as a family nurse practitioner, do you take care of women while they're pregnant or just before and afterwards?
Usually just before and afterwards. So I will see women while they're in their first trimester, and I'll help them get a referral over to an OBGYN to take over care. But there are some occasions where, let's say they got COVID or some other random virus while they were pregnant and their OBGYN was like, oh, just go see your PCP, then I will still see those patients. We actually had a situation where we had a Black woman who had a spontaneous coronary artery dissection shortly after she delivered. So she was about 2-3 weeks postpartum, delivering her baby girl, and was found on the floor unresponsive. And she was wearing a life vest for a long time until she could be seen by a cardiologist in the event that her heart basically would stop beating. And because of that situation, me being her PCM, she needed me to help advocate for her getting her referral into the cardiologist. So we were, on the phone with cardiologist. Hey, what do you need the referral to say? Let's get her in quickly. Can I get her an appointment? So we were able to move expediently to get things moving because for her, it was life or death. So that was probably one of our most scary situations that have happened.
Absolutely. So this just reminds us how important it is to make sure that we are lock in step with our primary care provider. And I know a lot of people are like, well, I don't want to go back to my primary care provider and tell them what's going on with the consultant. Why don't they always know? But just let everybody know, when you go to a consultant, the paperwork don't always get back as quickly as we like. day. So it's really important that, their primary care who is interested in you really understands what happens every single time you go out for a consult. It's that closed loop communication that your primary needs to have so that they can put all the pieces of the puzzle together. Given the nationwide shortage of primary care providers and the necessity for proactive model of healthcare, what steps can we as patients take both to alleviate the burden on our healthcare system and maintain our wellness?
I think the first thing is being able to advocate for ourselves. So, if I'm a patient, sometimes having a list, but also coming in with realistic expectations. So if that list has 10 things on there, chances are we probably can't get to all 10 of them, right? Because there's only so much time. In most offices, I think most of their visits are 10 minutes. At IWC, they're actually 20 and 30 minutes. So we spend a lot more time with our patients because a lot of it is education. And in order to advocate for yourself, we have to understand what's going on with our bodies. So I would say having a list of concerns, but also setting up a realistic expectation that we may only get to go through 2 to 3 of those concerns at a time. So, make sure we star the ones that are the most important to ourselves. And then, at the end of the visit, feeling free to ask questions. Now, it may take a couple visits to find out what the concern is. So being honest and realistic on that end too. There might be some follow-up testing, such as ultrasounds and lab work that are necessary. So giving that provider a chance. However, I will say, we do get a lot of patients that come in feeling like they've just been whisked in and out of a room, like they were just a number, that they didn't matter, that they brought up a concern and providers laughed at them or called them, not so nice names. In those situations, get a new provider. We don't have to take the abuse. There are providers out here who do care about your health and well-being. That's why we went into this field. So yes, although there is a shortage, we don't have to take abuse. So that list is helpful, but if that person on the other end is not connecting with us, if they're not listening to us, if they're not empathetic to our concerns, it may be time to find a new provider.
Absolutely. And, that's kind of what not even kind of, that's what we also do in the Viva Life Health Hub. A lot of what we provide for you is online education, communication, group therapy. And so when your nurse practitioner or your primary care provider, whomever it is that you're seeing, is not able to get you in as quickly as possible, having something like the Health Hub around you to be able to ask and for you to ask and answer those questions. And then also, like we always talk about, taking care of your spiritual, physical, mental, and emotional health is really important. So that meditation, that journaling, making sure that you're exercising at least 30 minutes every other day, as well as optimizing your nutrition with the types of foods that you're eating and of course drinking, then all of those things will also help to prevent some of the complications and the high risk chronic diseases that people are dealing with. And it can actually help reverse those diseases. So as you're going to your primary care manager in the in between time, it's the accountability partner that we can offer to you as well. So I think that's a really great point, and thanks for asking that question. Next question regarding blood work lab tests. Someone recommended a Dutch test. Can you tell us more about this if you're aware of it? And is it something that I can ask for my primary care?
Yeah, so I am aware of the Dutch test. We use it a lot when it comes to integrative and functional medicine type clinics. If we're not aware of integrative and functional medicine, it's basically there's 2 schools of thought. There's the Western medicine approach, which typically sees a disease and provides a treatment. And then there's a little bit of Eastern mixed in with functional, where there is a disease, but the focus is on how did we get to the disease? What is the root cause of the disease? And using that to focus a treatment plan. So Dutch testing has a lot of things on it when it comes to, especially when we're measuring like cortisol levels or doing advanced hormone panel testing. I personally don't use it because insurance doesn't typically cover it. And most of the time, my patients want to use things that insurance will cover. But there's a lot of similar tests on, other vendors like Quest or LabCorp that can be discussed with each patient, or if you're willing to pay the cash rates for them, there are some advantages, because I would say I don't typically see a lot of saliva cortisol testing on any of the vendors that I currently use. And I know you can get really good results on the Dutch test when it comes to dealing with adrenal fatigue and those sort of issues.
Yeah, I had never heard of the Dutch test, but I'm imagining it's, part of like a hormonal panel when you start talking about the saliva testing. And as we know, the perimenopausal testing is a big, big thing that's going on right now. So managing perimenopause as well as menopause and making sure that people are optimized with their hormones as naturally as possible. But if you do need some type of subsidized therapy, then being able to do that as well. So I'm glad that you are aware of that. And then, I like the fact that you're thinking, okay, this is what I can help you with, and this is what falls under your insurance, and this is what you're going to need to pay cash for. So people
Mhm.
have an understanding up front about what the healthcare costs that they're going to actually experience.
Yeah.
So I know that you were talking about a little bit about some preventive care for men, and you brought up prostate cancer. One thing people don't talk about a lot is testicular cancer. And I know that's a young man's
Mm.
typical cancer, but what are your recommendations on screening for testicular cancer?
So coming in, it's usually my men patients that don't come in, but even when you have young little boys, bringing them in, allowing us to do a genital exam, if ever anything is abnormal, looks abnormal, anything that hasn't been what you've been used to, bring that to the awareness of your provider, because sometimes we tend to, oh, everything's fine. Oh, my urination's a little different now, or I have a little bulge on this side, so everything's all good. And it's like, no, we need to take a look at that. Maybe everything's not all good. So staying on top of our healthcare and advocating for ourselves in those moments are going to be really important.
And then also back to the male genitalia. So we talked about prostate cancer. So do you test or do you screen Black men differently or earlier than you do a non-Black male for prostate cancer?
Actually, I do, especially with colon cancer too. But yes, age 35 to 40, we're having the conversation. And depending on their family history, and we talk about, being a Black man and what the risks are, let's go ahead and do this test. And most of the time, I don't have to fight with anyone. They're like, okay, let's go for it. As long as you don't have to touch me, but let's go for it. And then and if something's, abnormal or positive, it doesn't necessarily mean that they have prostate cancer, but I can at least get the initiation going to a urologist where they may feel a little bit more comfortable engaging in more additional testing.
Thank you very much, because that is definitely something that I think we all need to be aware of, that the incidents and the risks are definitely different for Black men than it is for non-Black men in regards to prostate cancer. So really important there. Now so since we're talking about every age group, let's talk about our postmenopausal and our mature patients. So, above the age of 65, and people are living longer now, and into their 80s and 90s. What do you recommend in regards to helping them continue to navigate their healthcare?
Yeah, absolutely. So this age range every year should have what's called an annual wellness exam. And that's literally where your primary care provider is going to talk about all of the chronic diseases that you have, whether it's high blood pressure, diabetes, high cholesterol. Make sure we we don't over medicate that population, because there's a lot of risk with a lot of the medications that they could be on. And then also those preventative screenings that need to be done, such as screening for osteoporosis, breast cancer, colon cancer. So it's something that the insurance companies are really checking in on, but that's something that we as your primary care provider wants to make sure we can check the box and say, hey, their care is in good hands with me, because these are the things that we are checking on. So in that age group, at least yearly an annual wellness exam. Usually that age group I'm seeing every 3 to 4 months for lab work, because there tends to be a lot of other chronic conditions that we want to make sure are being well managed.
Awesome, awesome. Now I want to give our guest audience, our studio audience, I guess you would say, more time to, if anybody else has any questions, go ahead and put that in the chat, And I also want to give you a chance, Nurse Practitioner Danielle, to go ahead and let us know about your practice and how we can get in touch with you, make an appointment if we're ever in the San Diego area. And we have a question. It says, what is the hemoglobin A1C and what is considered normal? Great question. Thank you.
That's a very good one. So the hemoglobin A1C is a blood test, and this is something that can let us know what the average blood sugar has been like over the last 3 months. So it's some patients are like, oh, I've been eating bad yesterday, so it's high. And it's like, well, that would be the glucose, but your hemoglobin A1C is actually a summary of the last 3 months. So it's basically how you've been doing over these last 3 months before your red blood cells have turned over. Now, this test, we want your goal to be below 5.7. Less than 5.7, you're good to go. When we start hitting at 5.7 to 6.4, that is pre-diabetes. And we want to do everything possible at that point to prevent it from turning into type 2 diabetes. Once you get above 6.4, that's when we consider it type 2 diabetes. And if you have type 2 diabetes, the goal is your primary care provider should be doing everything that we can to keep your A1C less than 7. Now, I will say there's something additional that we do here at IWC Primary Care, because oftentimes we'll see there's no type 2 diabetes, there's no pre-diabetes, but the glucose has been a little bit all over the place. We check for insulin resistance, because sometimes there's a precursor to even becoming pre-diabetic. And there's some things that we can do ahead of time if we already know, hey, you're on the path of becoming diabetic. Before we even hit pre-diabetes, let's go ahead and make some lifestyle interventions right away so that our numbers never increase into that area of danger.
And then just going back to, thank you for that reminder of the insulin resistance. That's definitely something, especially with like our polycystic ovarian syndrome patients, that,
Yes.
you know, we think about it with them, but we may not think about it with somebody else. So I love that, that as well. So thank you for bringing up the insulin resistance. Let's see. How do you integrate complementary and alternative medicine practices into your primary care approach?
So we do refer to acupuncturists and chiropractors when requested by the providers. We also order some lab work that's a little bit like, for example, insulin scores. You typically don't see that in most primary care offices. Same way with, thyroid antibodies. Someone may have normal thyroid or borderline thyroid, but if we can check your antibodies, we can kind of get a source of where this is coming from. So that's a little bit more advanced for endocrinology, but we'll run that here so that we can kind of address the root cause of why someone may have a deficiency within their thyroid, or even the opposite with hyperthyroidism. And then we also we'll recommend a lot of supplements for our patients. So depending on what we see, we'll check like an omega level in their labs to see how much DHA and EPA a patient is getting, because we know that when those levels are low, the risk of sudden cardiac death is a lot higher. So we may incorporate, hey, let's incorporate more salmon and avocados and nuts and seeds in the diet, or take a daily fish oil to help bring down those risks. So those are some of the things that we do here to impact the health of our patients.
Oh, so that means I'm going to need to bring you back to talk about these supplements. All right. So we have last question that we're going to be able to answer or ask. We already talked about hormone testing a little bit, so we can ask this other question about testing for screening for cholesterol, and if are there other medications besides pharmaceuticals that can help treat high cholesterol?
Oh, absolutely. So cholesterol, most of the time when we test cholesterol, I feel like I can do lecture for like 30 more minutes on cholesterol. But in summary, you're going to get your 4 basic levels: your total cholesterol, your good cholesterol, which is your HDL, your LDL, which is your bad cholesterol, and then your triglycerides. There's a connection usually between the triglycerides and blood sugar, which usually if you fix your sugar, your triglycerides usually correct themselves. But when we're treating and trying to prevent heart disease, we're really focused on the LDL. I actually had a patient once, he was trying to figure out, he was having a testosterone issue and didn't realize that his LDL was actually too low. They were over-treating him, which usually you don't say that because you worry about someone's heart functioning more so than erectile dysfunction, for example. So in this case, we lowered his statin dose because if you don't have cholesterol, you can't make testosterone hormone because the steroid hormone, the cholesterol is necessary for the outer lipid layer. I know I'm geeking out a little bit on too many pathos, but that stuff is intriguing to me. So for him, it was like, hey, you're taking too much statin, and then maybe we can bump you down off of this testosterone. So there are ways that you can treat cholesterol without a statin, for example. There are a lot of vitamins and supplements. There are also a lot of other pharmaceutical medications like a niacin or a fenofibrate. There are different options. So it just depends on what you've tried in the past, what your relationship is like with your provider, what sort of side effects we're trying to avoid. Those are the sort of things you want to make sure you're engaging in time with your provider to make sure we're picking the right medication for you. If you're, we call it an ASCVD risk, if your risk of having atherosclerosis, which puts you at risk for a heart attack or stroke, is really high, unfortunately, most of the time they are trying to put you on a statin because it's evidence-based to reduce your risk of heart attacks and strokes. So it just depends on what we're working with, what your percentage rates are for ASCVD, and what that provider feels is best for you. But there are definitely a lot of options when it comes to correcting cholesterol.
And I love the fact that you're giving us other options. So that means I'm going to be asking you to come back in April for a little breakdown on these talking about and recommending. And because people always want to know, I mean, every pharmaceutical you take has a side effect, and people want to know what is the side effect and what is my risk benefit ratio, and is there something else I could be doing to help improve that? So first of all, thank you for coming on. You're so amazing. Who you are and how we get in touch with you.
Yes, so I'm NP Danielle. I'm a family nurse practitioner, and I'm here in Spring Valley, California, right outside of San Diego. I own and co-found and co-own IWC Primary Care, which is located at 10225 Austin Drive in Spring Valley, California. You can reach us at 858-648-0755 or go to our website at www.iwcprimarycare.com. We'd love to have you. If you wanted to reach out to our team, I can be reached at np.danielle@iwcprimarycare.com.
All right. You're right. You are right. You are amazing. Thank you so much. And Viva Lifers, just to let you know who I am, I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. And you are in the Viva Life SPF Me Zoom room. There's a lot that we offer. And number one, it's having subject matter experts just like nurse practitioner Danielle coming on. We do this every Monday night, 7:30 p.m. Eastern time, and we're grateful to have you. Also, please remember that we are having our affirmation room, and people ask me all the time, what's an affirmation room? It's when we come into the Zoom room for 15 minutes for 3 nights, and we talk about, what are our goals? What are we affirming in our lives? And what are we letting go? The reason why is because just like you have clogged arteries, you have clogged spirituality, and you have things that prevent you from being your best and healthiest self. I'm trying to set you up so nurse practitioner Danielle can see you and just say, you got a clean bill of health and you've been doing a good job. So keep going. You can find us on at Dr. Kelly OMD on Instagram, as well as www.drkellyomd. Have a wonderful evening, everyone. Thank you so much. And please remember to share, like, and follow our YouTube pages, Facebook, as well as our Instagram. We want you to have your healthiest and wealthiest life. Have a good evening. Viva Life. All right. Thank you for being a part of the Viva Life experience. I'm Dr. Kelly OMD, board certified OBGYN and healthcare executive. If you like what you heard, then please go ahead and like, share, and subscribe. The reason why is because we are trying to educate, encourage, and inspire 1 million people to live their healthiest and wealthiest life. And this is what we're bringing you. We're bringing you educational videos. We're bringing you podcasts. We are bringing you webinars with subject matter experts, including myself, about the topics that affect you the most. So go ahead, like, subscribe, and share. We are everywhere. Have a wonderful day. Viva Life.